Hello friends, I am Dr. Harvinder Singh. So I'm actually excited to introduce today a brand new feature of Psychiatry Education Forum Academy, and it's called Psychiatry Studio. And Psychiatry Studio, very briefly, is a curated learning space that will offer standalone, high-yield clinical courses on topics that matters most in psychiatric care. And like our academy membership's goal, we will all these courses in Psychiatry Studio will focus on busy medical professionals in mind, and we will only discuss topics of clinical relevance for our daily clinical practice. So Psychiatry Studio was created with the goal, well, as you all know, Academy membership is a yearly membership. It has many courses, but I decided to create Psychiatry Studio for non-members as well, so that people who are not interested in committing to yearly subscription yet, they can join these individual courses. And actually, let me show you that thing. So it's this Psychiatry Studio is included in Academy membership for no extra price. You will get access to all the courses immediately. But non-members, they can enroll in any of these courses individually with a simple one-time payment and no yearly subscription required for these. It's a great way to experience Academy's educational quality without a long-term commitment. And if you find a value here, please consider joining our Academy membership. And now I'm excited to announce our first course in Psychiatry Studio, which is Review and Expert Opinion on Neuropsychiatric Assessment of Motor Functional Neurological Disorder, like also known as conversion disorder in past. Well, we all know how challenging and misunderstood this diagnosis is, functional neurological disorder. And this course will focus on understanding the motor presentations like weakness, tremors, gait disturbance, abnormal movements. But this is a very, very difficult topic. So what I have done is I have actually reviewed this summary and expert opinion published in the 2021 article in the Journal of Neuropsychiatry and Clinical Neurosciences. And I will be your instructor in this course. It's a 3-hour course, and I will walk you through 3 focus modules to help you navigate this neuropsychiatric assessment of motor functional neurological disorder. Very briefly, I will talk about these, but please scroll down and read more details about what all is included in this course. This first module will be on understanding how to do clinical interview, what all to include in the clinical interview. This is a 60-minute chapter divided in 2 chapters. So here you will learn a structural approach to evaluate the illness in terms of many factors, but few of them are onset, psychosocial factors, history, trauma history, comorbid psychiatric conditions, illness perceptions, suicidality. It's actually more. Please scroll down and read more. And in the end, I will talk about the expert recommendations on conducting interviews with the goal of helping you guide toward this right diagnosis and building a therapeutic rapport with your patients. This is module number 1 for 60 minutes. Module 2 is on physical examination with focus on neurological examination, almost close to 50 minutes in duration. Here we will go on step-by-step guide to knowing about bedside signs you need to look for. There are many signs I went over in terms of how to perform them and what are positive signs and how to interpret those findings, which is outside this article that I was talking about. So that's something extra I have added. And more importantly, you will learn how to differentiate these functional symptoms from organic neurological disorder with confidence. And actually, I will add a small video on, it's actually less than 5 minutes video from this course that you can watch in few minutes, where I have compared the signs you need to look for the functional gait disorder. I'll post that in after I'm done with this. And then the last module is on the role of adjunctive test. Again, close to 1 hour presentation here. And here I will compare testings like EMG, EEG, accelerometry, TMS, neuroimaging study, and how to interpret those and what the data shows, with the goal of gaining clarity on when and how to use these tools to support diagnosis. And I will recommend, if you want to sign up or learn more, please either go to psychiatryeducationforum.com/psychiatry studio or psychiatryeducationforum.com/course/motor-f&d. This will take you to the main page, and if you're an Academy member, you can start watching immediately. You will be given immediate access. But if you're not member yet, please consider subscribing. I'm keeping the price low so that most people can benefit from this. And now I will post that video from this course on understanding what are the signs you need to look for in functional gait disorders. But if you have any questions, please post your comments below or go to our website, and there's a contact us button on top, or you can send me an email directly at hsingh, HSINGH, at psychiatryeducationforum.com. But till then, friends, you all take care and bye for now. Thank you. Now, let's discuss individual disorder, individual symptoms that a patient will present with, and which signs you should look for, and how to differentiate them from organic conditions with similar presentation. Functional gait. When a patient is presenting with a gait disorder, what are the positive signs that you can see in a functional gait disorder? First, dragging gait. So dragging gait is very interesting. A person will be dragging either their one or both legs while walking, and you can easily tell there is a lack of coordination because one leg, they're not using both legs with the strength. And as I mentioned, exaggerated effort, right? That third thing that we talked about in journal signs, you will see that. And the foot will feel like it's getting stuck to the ground like a magnet. That is dragging gait. So look for dragging gait, number one. Second is huffing and puffing. So it's again go to that third journal sign of exaggerated effort. So there is exaggerated or labored breathing, but it's very disproportionate to the actual physical effort they're doing while walking or standing. So this is a second sign, huffing and puffing. Third is falling with support. Now, patient will often present as a slow motion or theatrical looking fall, but overly cautious fall though. Most of them will manage to catch themselves by grabbing a furniture, wall, examiner, or something nearby. But if they fall, they will fall onto something soft or to the ground in a very controlled way. So, this is what falling with support is. And then you will notice abnormal slowness, like we talked about, or abnormal hesitation. And the posture is very important. The posture they talk about in functional gait is the non economic position, non economic posture. And what that is, they will stand or walk in a way that is not very stable, yet they will not fall. And more importantly than that, it will look more painful or exhausting, but the patient will be able to maintain their posture for long period without fatigue. And the last is knee buckling. Now, the knees will suddenly give out, or they will suddenly lose strength in their legs. It can look like their knees are about to collapse, yet the fall is rare. And the thing with this giving out is knees can give out with minimal force, but the strength returns immediately. And we will talk about how to test that in the physical examination section, those signs later on as well. But there's one way to test it. Whenever a patient is presenting with functional gait, so you have looked at dragging gait, huffing and puffing, falling with support, abnormal slowness, hesitation, non-economic posture, or knee buckling, then you can do this chair test. But what is chair test? So in chair test, you ask a patient to sit in a chair or on an examination table, and their legs are hanging, and you ask them to walk while they're sitting, like you mimic the leg movements of walking. And this is how you differentiate organic disorder versus functional disorder with this chair test. First, you look at their leg movements while seated. Patients with organic gait disorder will still have weakness or uncoordination, but with functional gait disorder, it may appear almost near normal, very coordinated or fluid. And while they are making effort while seating, like they're making that effort of mimicking walking while seated, organic gait disorder will have a genuine efforts, but definitely because it's organic, there will be limitations seen in that. But in functional gait disorder, the efforts are little or no, and movements will be very smooth mostly. And then you also observe their gait when standing. So after they have done the test, in the organic gait disorder, it matches the seated performance, but it will be worse than the seated movement in the functional gait disorder. So here is a summary of positive signs in functional gait disorders. You can keep this picture in mind. That's why I have put the pictures, so that's how I use it while looking for these in my patients. So dragging gait, huffing and puffing, falling with support, non-economic posture, abnormal slowness or hesitation, knee buckling, and chair test.